What is no moisture treatment? Commonly abbreviated to NMT, this is a method used by TSW sufferers to speed up recovery and reduce the time it takes to heal. The aim of the protocol is to dry out the skin to allow the surface to scab over and then consequently allow the damaged area to produce new skin cells underneath. Dr. Kenji Sato founded No Moisture Treatment after monitoring his TSW patients at Hanan Chuo Hospital in Japan. Dr. Sato is known as the leader against topical steroids. The steroids used by TSW sufferers mimic cortisol, which is a hormone that is produced in the adrenal glands. And because we apply this to our skin, our body now needs to relearn how to produce its own cortisol and how to re-moisturize itself. By following NMT, we give our body a chance to do this. So, how do you do NMT? Well, there's 8 main steps that you need to follow. Number 1, and the hardest, you must restrict your water intake to 1 to 1.5 litres depending on your weight and your severity of your skin. This also includes the amount of water in your food. To know that your water intake is at the correct level, check your urine and it should be a concentrated yellowish colour. Number 2, no moisturisers, creams, lotions, oils or ointments, etc. can be used. Number 3, you must sleep between the hours of 10 PM through till 2 AM. This is where you get the most rejuvenating effects as you are aligning your sleep time with the body's natural hormone secretions, which ultimately leads to the most optimal amount of skin repair. Number 4, no baths and reduce your showers. Have a quick cold shower every 4 days to 2 weeks, depending on your severity to avoid infection. No shower gels, lotions or scrubbing can be done either. Number 5, 1 hour's worth of exercise should be completed every day, with your heart rate exceeding 120 beats per minute. This speeds up your metabolism for regeneration of new skin cells and helps your serotonin levels if you're feeling low. Any sweat that occurs should be tapped gently with a towel, not rubbed. Number 6, do not wipe any use or touch it. Leave it alone and let it air dry so that it can form a scab, which will also help prevent infection. Number 7, do not wear too much clothing as this can work as a moisturiser. Any clothes that you do wear should be light and loose. The same applies for heavy blankets in bed. Make sure that they are very light and do not stay in bed all day, as again, this can act as a moisturiser. Number 8, do not pick any skin or flakes that begin to form. Let them fall off completely naturally. Scratching is okay and completely inevitable. Just make sure not to go crazy with it, and if you do, remember, don't touch the ooze or wipe it, just let it dry out. If you are to do NMT, there's a couple of recommendations to be made for your health, as this is an intense protocol for a drastic disease. Firstly, a doctor doesn't have to agree with what you're doing, but having them check your vitals or seeing if there's any irregularities in your health is important. Secondly, if you get sick in the protocol, Dr. Sato instructs that you should completely stop to allow your body to get all the fluids it needs to be able to recover, and then you can begin NMT again once it passes. Finally, is it okay for children to do this? Any children under the age of 6 is recommended not to do the water restriction, and the same applies for pregnant women. This information was taken directly from Dr. Sato's Facebook group and blog, which I will link below if you have any more curiosities or need more guidance on how to follow NMT and the kind of results that have occurred due to this process of healing. If this has helped, make sure to like the video and subscribe for more content like this.